The views expressed on this program do not necessarily reflect those of this station. Welcome to Insights into Northeast Michigan. This is a Channel 11 News public affairs program dealing with the issues affecting those in the community as well as Northeast Michigan and the state. And now, Insights.
Welcome to Insights. I'm Annie Taylor. I'm sitting here with Dr. Young, the radiation oncologist at the ARMC. Now, today we're going to be talking about, obviously, October is Breast Cancer Awareness Month. So first off, I want to talk about radiation oncology. What is your job?
My job, Annie, is to use the tool of radiation to predominantly cure cancer. We have other uses for this in diseases that are not cancer, but primarily we use radiation to address cancer in a local region, similarly to the way a surgeon would use a knife, except for this is really energy or from the outside, and we're destroying cancer cells by breaking the DNA inside the cancer cell.
Now, for women who have breast cancer, I'm guessing those are the people who go under radiation, correct?
Well, women have many options that have breast cancer, and radiation is certainly one of them. And there are different types of radiation over the years that evolved in the way that we use radiation for breast cancer. But the important thing about radiation for breast cancer is breast cancer was one of the first sites of where cancer is where radiation allowed for the organ that had the cancer in it to be preserved. In essence, we save the organ. In other words, this concept has been used for other cancers like the vocal cords or the legs or arms for certain types of cancers where those organs are saved. Long ago in my life, being maybe 30 years ago, we learned that we could save a breast and still come up with the same local cure rate as if the breast was amputated or taken off with a mastectomy.
So what are the benefits of radiation for someone who goes under it, and how long does the process of radiation take?
Well, radiation can be given in a number of different ways for breast cancer. There's newer information that shows that women can be treated in less time, and there's more traditional information. Typically, radiation after someone has had surgery is a number of weeks, usually around 6 weeks, sometimes a little more. It depends on the size of the fraction, if you will, or the amount of radiation during a treatment that a woman will get for breast cancer. And I just want to point out that 1% of all men, 1% of all breast cancer cases rather occur in men. That's something that we forget about a lot.
Definitely, and I think that's a really good point that you mentioned. Now, at the Alpena Regional Medical Center where you work, how is breast cancer up there and things that you guys treat, or is that low on the list?
No, absolutely. It's one of the top 5 cancers that we see. And that's common across the United States.
Now, why do you feel that October obviously is dedicated to breast cancer awareness? Why do you feel that bringing awareness to breast cancer is so important, especially for women?
Well, I think for a long time we've seen that women are caretakers. When we look at our mothers, our sisters, our daughters, our wives, we think of them taking care of everyone else. And in a lot of ways, and this is a personal sort of psychological, emotional answer that I'm giving to you as a person as much as a doctor. And I think we as a society have rallied around our caretakers, the women in our lives. That's from the male perspective, but women also see each other as sisters and moms and daughters, and women also have taken charge of their health in a lot more direct ways they've been advocates for their health needs and freely expressive of them. Tremendous efforts have been made by the Susan G. Komen Foundation and others to raise breast cancer awareness to the point where we see it on our team's jerseys on Sundays when we watch NFL football. We see walks all over the country, and it's a wonderful thing that this kind of energy has been harnessed and is at the grassroots level as well as at very high political levels involving lots of resources.
Now, do you feel that because of that breast cancer awareness is becoming more prevalent, people are getting involved in that people have been preventing themselves from getting cancer to a bad extent?
I think that the breast cancer awareness fuels the fire for preventative medicine in breast cancer. Absolutely. Women learn about mammograms. Women learn the importance of mammograms. There's education involved in this movement. People talk to each other and what kind of experiences they've had. And I absolutely yes is my response to your question.
Now, Alpena is known for having obviously the regional medical center and how it focuses a lot on helping people with cancer. Have you seen a decrease or an increase of cancer patients, or more people who are getting help for themselves, more women maybe, if we can go off that?
To be frank with you, I've been in Alpena since the middle of the summer.
Okay, fairly recent.
Came up from as a faculty member from the University of Michigan, and but I was in a setting that was similar for approximately 6+ years as a satellite of Dartmouth Medical Center in New England, and I would say that I have seen women, I have seen the movement take off, and on a national and local level I'm seeing more support for breast cancer awareness. And I don't have a pink tie on, but I have a pink heart.
I like that. So that's a good thing too, that we all should wear our pink this month, correct?
Correct.
Definitely support that. Now, before we let you go, and we're going to move on to our next segment with our other doctor, what do you have to say for those people out there who haven't gotten checked with mammograms, or maybe who have a loved one who does have breast cancer? Do you have any thoughts for them?
Well, that's a wide question, but I would say absolutely talk to your family doctor about the screening guidelines. Get screened. Do it. Because you can catch something early, it's a lot easier to treat it. Or if you have a pre-invasive cancer, you can address it much quicker. And also those that have breast cancer in their families, I would encourage love and support and bearing with that person going through that particular trial. Looking for support groups, looking for people to talk to. Caretakers get burnt out as much as patients do going through these treatments.
Right. Thank you so much for sitting down with us today. Now, when we come back, we'll be talking to a doctor about breast imaging. So stay with us right here on Insights. Welcome back to Insights. I'm Annie Taylor. I'm sitting here with Dr. Zweig of the Alpena Regional Medical Center. Now, what department are you with?
We're with the Department of Radiology.
Now, what is your job title?
My job title is diagnostic radiologist. I'm also the director of breast imaging for the facility.
What does your job entail? That seems a large scale of jobs that you might do with all those.
Well, aside from interpreting all of the radiologic modalities and procedures that are done in the hospital, we have special training in the diagnosis and interpretation of breast imaging.
How did you get involved with breast imaging?
I've always been interested in women's health. As a matter of fact, when I first began my medical career, I was training to be an obstetrician. From there, I went into radiology, and after that, I just became very interested in breast imaging.
Now, for the viewers out there who may not be clear about breast imaging, what is breast imaging? Breast
imaging predominantly is the use of mammography for the early detection of breast cancer. However, beyond that, we do have additional imaging modalities, and that would include breast ultrasound and breast MRI.
Now, typically when you hear breast imaging or getting a mammogram, you think of 50 and older, 60 and older. Is that true, or how old should you be?
We like to begin yearly screening mammography. By screening, I mean women who do not have any problems or symptoms in their breast. We like to begin imaging at the age of 40. And imaging should be done with mammography every year after the age of 40. However, if there is a strong family history of breast cancer, or there's a history of the breast cancer gene in the family or in the woman herself, we generally like to begin the imaging much earlier, at the age of 30.
At the age of 30?
Yes.
Now, what kind of symptoms, if, like you said, if maybe they don't have the gene in them, but they aren't 40 yet, what are the symptoms that someone might kind of feel? Are there any?
Yes, there are, and as a matter of fact, we do divide our mammography into two types of tests. One would be called the screening test, and that's done every year in women who have no symptoms, no breast problems. Then there's also the diagnostic test, which is similar. However, these are done in women who are having any kind of breast symptom, and that could be breast pain, it could be a lump that is found either themselves or by their doctor, or at sometimes a discharge from the nipple.
Now, how important is breast imaging for women especially?
Well, it's extremely important. Here in Alpena, we do diagnose breast cancers usually about 50 times a year. We have 50 different women every year that we're able to make this diagnosis in. The greatest importance is to diagnose these breast cancers when they're small. And when we do this, the treatment and potential cure rate is very high. And so if we find these cancers when they're small on a screening mammogram, generally speaking, the cure rate is 95 to nearly 100%.
Women oftentimes, I mean, even speaking just for myself, I'm not at the age to get a breast exam yet, but they oftentimes feel scared or nervous for it. Is that something that they should be, or is it just a common feeling?
I think it's very common amongst women. I think it's common amongst the general population. People really don't want to find out that they have something wrong with them. But with breast cancer, early detection of breast cancer, as I said, we really can cure these things more easily when they're found when they're small.
Now, how many women do you see typically a month or a year maybe?
Well, I'd rather say that we usually do, well, let me put it this way. Last year we did approximately 7,000 mammograms in the Alpena Medical Center. That's probably about 20 to 30% of the number of women in this community that should be screened.
Oh, wow.
Throughout the state of Michigan, we are getting approximately 50% of the women who should be screened. So in our medical center, we're getting a smaller number of women than we should be, and I'd like to just reiterate how important it is for women to get these screening mammograms every year. Don't skip a year or two. We do find very small cancers between the yearly screening mammograms.
Now, you brought up numbers, especially in Alpena. Have you seen a difference, maybe numbers that have gone up or have decreased of patients who come in for their breast exams annually?
No, we're pretty stable as far as the number of exams that we do. What we have seen nationwide is an increase in the rate of breast cancers in women, which makes it even more important for them to come in.
Definitely, and I think that kind of goes back to that notion that women are a little bit more timid to go in, but that should make it all the more to go in and get your breast.
Exactly.
So what do you have to say for those women out there who haven't had one yet?
Well, unfortunately, there are some media physicians, I should say, that whereupon there's some controversy as to whether or not women should get their mammograms every year. Anyone who's in the breast cancer field, either by imaging or treatment, will disagree vehemently with these media physicians. It's extremely important for women to begin their screening at age 40.
All right, and before we go, I wanted to talk to you about, I know monthly breast exams for yourself are very important as well. Will you talk to people a little bit about that?
Yes. The person who knows how their breast feels best is the woman herself. And it's recommended that every time you take a shower, or at least once a month, to self-examine your breasts. And we can show you how to do that when you come in for your mammogram. If you do feel something different, anything different, between one monthly self-breast exam and the next, you should then see your physician and have your physician do an examination and recommend or order the appropriate imaging for you.
Now, you said in the shower. I know that I've heard also from my physician, and tell me if I'm wrong, because I don't know if other people out there have heard this too, to do it while you're laying down as well. Does that make a difference? Or
you could do it lying down, yes. It's also can be done in the shower standing up, whichever is easiest.
Right.
The important thing is to do it.
Do you feel, or have you heard that women haven't been doing that regularly, doing a monthly check?
Well, again, there was some media hype recently that claimed that the self-examination was useless. We don't agree. We who are in the breast imaging and breast treatment field believe that it's very important to do. There are many women who come in for their imaging who have felt something in their breast that was different the month before.
And I feel like a woman's intuition is typically on the right track.
Always on the right track.
Yes. Well, thank you so much for sitting down with us. Now, when we come back to Insights, we'll actually be talking to your right hand, I want to say man, but really woman. That's Tina Orban. She actually is a, how do I say this,
She's a mammographer.
Mammographer.
She's our lead mammographer.
Mammographer. That word to me, it doesn't roll off the tongue very nicely. But thank you so much, and stay tuned for Tina next. Welcome back to Insights. I'm sitting here with Tina Orban. She's the lead mammographer at the Alpena Regional Medical Center. Now, Tina, what does a lead mammographer do? What's your job?
Well, the most important thing is I get to image the women that come in for a mammogram. I also take care of all our books that the state and the federal government look for through every year. And I do some testing on the machines and things like that.
Now, how did you get started in all of this?
I was an X-ray tech, and then I did some special training in mammography, and then it just so happened that I got put in this position, and I love it.
Oh, well, see, that helps to love your job.
Yeah.
So I want to start with when women come in for maybe their first mammogram that they've never had before, what can they expect? I know people are on their little, on some nerves there.
Yeah. So. When you come into the mam suite, one of the mammographers will greet you, and we will give you a gown and ask you just to take everything off from the waist up, and then we'll take you into the room. We'll talk you through exactly what's going to happen. We'll do your exam, and then we'll send you on your happy way.
So how long does it take? It seems fairly quick then.
It actually is, for a screening mammogram, a very quick process. Probably from the time you're in the mam suite, about 15 minutes, maybe 20 at the most.
Wow, that is fairly short.
Yes.
Especially at a doctor's office. So.
I know. That's the most common thing. Women will come in and say, "You're ready for me already?"
Yeah.
Yes.
You're like, yeah, we get them in and get them out. So in regards to technology, I'm guessing Alpena Regional Medical Center is a cancer facility. That's huge there. Obviously, their technology has to be new and upscale. So, what do you guys use for breast imaging?
We are full field digital. We became full field digital in 2008, and it's a much superior technology to film screen or what we call CR, which is computed radiography. Our sensitivity level is much more than what those other modalities would give you.
Okay. And what are the benefits to those?
The radiologist can see what's inside the breast so much clearer. The image is just, if you would hold up a film screen to a full field digital, the difference is amazing what the radiologist can see. They might be able to see something so much quicker with a full field digital than they would with any other imaging.
Now, for the doctors, that obviously the newer and nicer equipment, you guys can tell. Is there anything about the nice equipment that the patients can tell?
Yes, the exam, the amount of time that the patient is in compression is quicker because the machines are quicker. The whole exam is much quicker too. Before we used to have to take the films and put them through a processor, and now the images come right up on our screen, so the patient's time that they're with us is quicker. Also, our repeat rate is less because we don't have to deal with things like the processor, you know, eating a film, or the technique. We have a little more playroom with the technique where we wouldn't have to repeat. So there's lots of different benefits.
Now, what do you mean by repeat for those people out there?
I'm sorry. Yes.
Okay.
To repeat a film, we used to have to repeat if the film was too light or too dark. Now with this full field digital, that's not the case.
So people don't have to come back if they've...
No, we would do those repeats right here.
Oh,
we
okay.
as a technologist.
Oh, okay. It helps your job a lot
Yes.
better then. So what are some types of misconceptions? Like, I know the whole, does it hurt? That's a huge one, I'm guessing.
Right. A lot of the misconceptions of mammograms is patients feel that it's going to be extremely painful. You know, I find the majority of women do not find this test painful. They may find it uncomfortable. They may find that it pinches a little bit, but most women find they can tolerate it. There are, of course, some women out there whose breasts are extremely sensitive, and for them, this may be a very painful test. But they just have to remember that that compression only lasts really a matter of seconds, and they'll be out of it, and you know, we'll just move on to the next. So, another misconception of mammograms is that the radiation is actually causing breast cancer.
See, I've heard that too.
Yeah.
What do you have to say about that?
That is simply not true. The benefits of this test definitely outweigh any radiation risk there would be. Another misconception we get is the patients think that the compression is hurting their breast. Oh, they'll never get back in. Yes, but that's not true at all either. The compression does not hurt their breasts.
Now, how long do the results take for these women to get back and know if they're cleared, or know if they might have to just have another checkup again?
We can get the results of a screening mammogram to the ordering physician usually in about 3 to 4 business days.
Oh, that's fairly quick.
Yeah, and we also mail the patients a letter, and that goes through the post office, so it takes about 7 to 10 business days for them to receive that letter.
But a fairly quick process. I mean, you say 15 minutes of getting your breast exam and then only a week to get results. I mean,
yeah,
you're in and out, and this is like no time.
Right.
So October is Breast Cancer Awareness Month, obviously. I love your shirt, by the way.
Thank you.
Now, we have the walk coming up, but before we get to that, I want to know, for women out there who are watching this and maybe can't afford a breast exam, does the Alpena Regional Medical help in any way?
We have the mammography subsidy fund at the hospital. What that does is actually what the Zonta Walk is raising funds for today, or excuse me, tomorrow. What it does is it pays for women who cannot afford their mammogram, who may not have insurance or who just can't afford to have a mammogram done. And there's clinics, and our mobile unit goes to these clinics, and they screen women through the mammography subsidy fund. So it's a great cause.
So you guys have helped women who may not be able to afford it.
Yes.
And do you guys do that in the month of October? Do you go around helping people?
Yes. In the month of October, there's the free clinics, and our mobile unit goes and does the free mammograms, which the subsidy fund has the funds for that pay for it.
Now, for the walk coming up, have you participated in it before?
Yes, I have, every year.
So what's it like? I've never participated in it, and if for those out there who haven't either, what can we expect?
It is so much fun. When you first get there, it's just a big sea of everybody wearing the same colored shirt, and generally they're pink, they've been brown, but it's and it's just, you see so many people, and we have a speaker at the beginning, and then we all just go on this walk, and just enjoy some friendship and know that we're raising money for a great cause.
See, that's great. So how many people, you said like a sea of people?
Oh my gosh, I wouldn't even begin to wonder how many people there are. I don't know. It's
thousands?
I don't know if it's thousands,
but there's a lot. There's a lot.
700 maybe.
I think it's great that the community is coming together and, you know, raising awareness, but also helping fund people getting mammograms, let's say. You know, just simple things like that the community can help to raise awareness for people in the community.
Right, and it's great. The whole walk is great. The whole experience is great.
And Zonta is it helps fund Alpena Regional Medical Center certain types of cancer awarenesses or fund money for that?
Zonta does a number of different things, I believe, in the community. This is just one of the things that they do, and they're a great organization as well.
Definitely. We've been covering a lot, so that's good. Well, thank you so much for sitting down with me, and remember to go out to that breast cancer awareness walk. That's tomorrow, correct?
Tomorrow, yes.
Yes, awesome. I'm sure you can't miss the people all in pink.
No, you won't.
Make sure to catch Insights next week at 11:30.
Insights into Northeast Michigan has been a Channel 11 News public affairs program. If you have any comments, suggestions, or topics you would like to see on a future show, please email us at the web address on the screen. This has been a production of Thunder Bay Broadcasting Corporation. All rights reserved.